World War II had just ended, and many veterans were coming home from the theaters of war. Hundreds of thousands of veterans that were wounded or had illnesses of war and needed to be treated as soon as they came back. The VA wasn't set up to care for this many veterans. Some brilliant physicians decided to create a partnership between academic institutions and the VA system. This would bring senior clinicians from medical schools with their trainees over to the VAs and help care for veterans, immediately improving the quality of care and the staffing deficit, but also provide a learning experience for these trainees.
For the past 75 years, academic medicine and the VA have had a wonderful relationship which really has impacted the public health. The physician training that happens at VA is incredibly important, and about 70% of all of our physicians from the United States get part of their training at the VA. 124,000 healthcare providers that were trained in the last year at the VA, over 40 different healthcare professions. So the impact is huge, and it's through this very special relationship with the VA and academic affiliates that this all happens.
You know, I believe that the collaboration that we've had has been extraordinary. We have benefited from having our students assigned to the VA for their clinical rotations. The VA has benefited from having our faculty serving as preceptors for the trainees. So it's been an extraordinary symbiotic relationship. The combination of the VA and the university hospitals, we have thousands of faculty. It gives the type of breadth of opportunity, of health care that would not be ordinarily available elsewhere. And the veterans are the beneficiaries of that investment.
Interdisciplinary, interprofessional, multidisciplinary, there are many words for different kinds of health professions working together. We emphasize the whole person and whole health. That's hardly ever a one kind of profession. You need multiple people, and when they work together in a coordinated fashion, you help to maximize the health for the person.
We have affiliations across all health professions, from doctors and nurses to licensed professional mental health counselors, marriage and family therapists. A lot of mental health trainees rotate through VA, and that's really important for veterans.
I think it has meant the veterans get better care dramatically over the years, and I think the affiliation with the educational institutions means we both learn. The academic affiliation partnership and that model has been vital to VHA, our veterans, as well as for our country.
And we are able to recruit expert people from our academic institutions and the trainees to be able to provide the highest quality of care to veterans probably in our history. I think this is directly tied back to our affiliations with academic institutions.
I think we have a next 75 years that's going to be incredibly bright. We are going to see enhanced clinical training for our students. The research is going to continue to expand. We're going to hit on new areas that are particularly important to veterans: post-traumatic stress disorder, traumatic brain injury, neurological injuries.
The Office of Academic Affiliations is always looking to what's next. What is next? What is going to be where healthcare goes? What is going to be how we can make a difference? And how do we find those things out? Well, we try to pay attention. We have advisory committees who make suggestions and provide input and ask us questions that make us think differently sometimes. We also coordinate with so many of the professions that they provide us ideas. We have undertaken a number of initiatives to help expand our affiliate network, and that will continue to occur because it's important for the veterans, their care, and the training of the healthcare professional trainees.